Hello everyone and welcome to the Culturalist. I'm James Blanken. Today's topic is mental health, focusing on what is going on up here. It's important to our well-being and maintaining some sanity. Personally, I lost all my sanity at the start of 2020, but that's besides the point. The United States government, a shining diamond in the world of democracy, a beam of light in the darkness. I'm fucking with you. Yes, the grand experiment of America continues. For now, and you think the government would care about us and our mental states. Haha, well, no. But it's a bit more complicated than that. See, mental health has always been an issue in this country. We see people struggle every day in big cities by just walking outside. Many people are homeless and suffering from critical mental health issues. So what does our government, which is made for us, do about it? Well, not much, especially recently, and probably won't for a while. But there was a bipartisan effort to try to do something. Introducing Improving Access to Mental Health Act of 2023, or S838, or HR 1638 for the government nerds out there. And I know, hearing bipartisan legislation on mental health is kind of crazy. There are many things you think before hearing Democrats and Republicans working together. It's like watching a group of loveless, hypocritical zebras who never get enough love as children, putting their differences aside and working together. Sounds out of pocket and crazy, but it's true. It happened. Senators Debbie Stabenow and John Barrasso, and in a House by Representative Barbara Lee and Brian Fitzpatrick, worked on this legislation. But I guess even in trivial times like the ones we're in now, agreements and compromises do happen. The bottom line, however, is that this piece of legislation would help cover many costs concerning mental health, and in turn, help a lot of people. Firstly, the legislation aims to increase reimbursement rates for clinical social workers, or CSWs, from 75 to 85% of the physician fee, aligning them with other non-physician providers like nurse practitioners and physician assistants. This makes mental health professionals equal to general physicians. A doctor puts a stick down your throat or a syringe in your arm and tells you to go home. A therapist or psychiatrist has to dig deep into your complex and often convoluted history. And that is not easy. Like, look at me. Do I look like someone who could get it all out in 40 minutes? The point is, equal pay in this field is very much warranted and deserved. Next, the bill aimed to enhance the scope of mental health practices. It would allow CSWs to provide health and behavior assessment and intervention, or HBAI, services, and remove restrictions on providing psychosocial services in certain settings, such as nursing homes. The bottom line, it would expand mental health care to many more people than it did before. Way less strings attached. Strings Attached was also the official stripper for United Healthcare employees. Finally, and most importantly, the bill would address access challenges. By incentivizing licensed CSWs to become Medicare providers, the legislation aimed to mitigate mental health provider shortages, particularly in rural and underserved areas. By making clinical social workers Medicare providers, a lot more people all over the country would receive the help they need. So that is like the Spark Notes version of the bill. You don't have like all day. And you might be asking, James, the bill S838 or HR 1638, Improving Access to Mental Health Care in 2023, has the title 2023 in it, not 2024 or 2025. So what the hell? Well, the deal is the bill did not pass because it didn't gather enough bipartisan support, although it was a bill made bipartisanly. What does that tell us? Nothing makes fucking sense. Both Dems and Republicans came together and made this legislation to still be turned down. I wish I could blame Trump or even Biden or somebody, but I can't, because this is actually an example of just the everyday bullshit in Washington and why things can't get passed. This is why we can't have nice things. And of course the bill cost a ton of money, but nothing in life is cheap. So what now? How can we make a difference in the next 4 years of this winter we're about to enter? So let's go to least to most effective, or what I call the honesty meter. Well, us, the American people, can contact your representatives and senators, express interest in the bill, and emphasize the need for increased access to mental health services in skilled nursing facilities, and the importance of equitable Medicare reimbursement rates for clinical social work. Come on, you think that's going to happen? That will, of course, fail in piles of horseshit. And if you live somewhere like in South Carolina and you have like Lindsey Graham as your senator, do you think he cares about your community health care? No, he's too busy, I don't know, massaging Donald Trump's feet or watching babies cry in the park. The point is, advocating for Bill's reintroduction will not work with Republicans in control during the upcoming Trump administration or the next Congress. They do not care. Honestly, I would be surprised if Trump knows what mental health is. I think his mental health is just a Big Mac. But let's look below the government level. One can engage with federally established programs like the Certified Community Behavioral Health Clinics, or CCBHCs. They aim to expand national health care, and some of the things they are aiming to do align with the goals in the improving access to mental health bills. These programs need your support. And on a local level, engage with local advocacy groups like the National Association of Social Workers, or NASW, or the National Council for Mental Well-Being, which often run campaigns to advocate for such legislative changes and can help you understand how to advocate yourself. The point is, even in dark times, there are many options we could do to help people in our communities. I know it may seem that progress is slow for proper mental health care in this country, but even though federally things are not passing, things are happening. And these organizations are the proof. It starts on the ground, not the top. Don't expect the Burger King delivery boys or the current Republican majority to help you. They're only supposed to do one thing.
If Donald Trump says jump 3 feet high and scratch your head, we all jump 3 feet high and scratch our heads. That's it.
Woof, woof. That would be someone, a House Republican, the American people would have to pension to try to get that bill reintroduced. Do you think he cares? Here's the answer for you. Woof. Republicans won't do anything the president doesn't know about, and Trump surely does not know or care about mental health. If anything, he wants his big friends who are billionaires to make more money, like maybe CEOs of big healthcare companies. I will say, don't shoot someone dead to cause healthcare change. It won't work, no matter how hot you are, and hey, my eyes are up here. We lead the change, not our government or extremist. Us. Be a true patriot. That's all I have today. I've been James Blinken. This has been The Culturalist. Thanks for watching.